Good afternoon. I'm George Latimer, Westchester County Executive, and it is Monday, March 29th. We're here for our Westchester coronavirus update. This is the first of two updates for the week, and I'm joined, as I always am, by our Deputy County Executive, Ken Jenkins, who will be reporting on a couple of the different bullet points that we have to cover today. I'm going to do the basic numbers, then I'm going to invite our guest for today, who has joined us from the village of Tuckahoe, Mayor Greg Luisi, and I'll give him a proper introduction in just a few minutes when we ask the mayor to join us. The numbers are up to date as of today from the New York State tracker. We have total pandemic to date 118,964 individuals that at some point in time has tested positive for coronavirus. 113,204 of them tested positive 2 weeks or earlier than that. That gives us 5,760 active cases. Now that number has flattened out. Actually, it's gone up a little bit in the last 2 weeks. You may recall, if you follow these reports before, we had a steady decline from the middle of January. It was fairly steep and regular. We went from a high number, 11,500 or so cases, down to as low as 5,200 cases. We've now inched back up to 5,700, just to give you the comparisons, where we were a month ago. Now, there was no 29th day of February, so we'll use the first day of March as the 1 month ago. We had 6,041 cases. That's only an aggregate drop of about 300 cases in the course of a month, compared to the prior month. If you go back to where we were at the end of January, we were at 10,812 cases. 10,812 cases, down to 6,000 cases in a month. That's a drop of 4,000 cases. The last month, a drop in the aggregate of 300 cases. And over the course of the last 2 weeks, that number's actually risen some, 5,760. So we presume that the variants are creating a more communicable disease, and there are more people that are testing positive for COVID today than 2 weeks ago. The other indicators have been an improvement over where we've been before. The last number that we have on hospitalizations goes back to Saturday, where we had 259 people hospitalized. That number had dropped down over the last 2 months from 588 down to 259. That's a great drop. However, over the last couple of weeks, that number's actually risen a little bit. We had 253 people hospitalized 2 weeks ago, 256 a week ago, 259, and the number was actually a little bit higher during the week. At one point, we got up to 284 people hospitalized. So the basic trend, what we're looking at, is that there has been a slight rise now after a steady drop that dates back to the middle of January. Our fatalities now are just shy of 2,200 Westchester residents who have died from coronavirus, 2,194 over the course of the last week. That's 23 individuals that have passed away. In the prior week, we were a little smaller than that, slightly around the same area, about 21 individuals. So every fatality is a loss of a person, not a statistic. But we were dropping fairly regularly. We had lost 50 a week and 40 a week, and we dropped down to about 20, so that number's about stabilized, which means we're still very much in the middle of this pandemic. We are not out of the woods by any stretch of the imagination. And I know that with the coming spring, we all have spring fever. We also have pandemic fatigue. I have it just like everybody else does. We'd like to take the masks off and never put them back on again if we could do that. We know there's going to be more outdoor dining now, so we're going to feel like we're ready to go out and be part of the world again after going through the long winter. But the numbers are not as encouraging as we hoped they would have been. We thought we'd continue to have a downward direction, and it's flattened out. It's stopped, slight uptick. So we'll see what the next week brings us as we look at these issues. We will take a quick look at the vaccination numbers as they stand through yesterday at the county center, which is the single largest location for vaccinations. It's been open over 2 months, operates 7 days a week, 11 hours a day. They've issued 144,252 vaccinations. That's both first and second shots. And we have at the Yonkers Armory, which has been open for the vicinity of about a month, 25,000 shots, 35,102. And the two clinics, which are both the White Plains Downtown Clinic and the one at the community college and the gym, which is on the Greenburgh-Mount Pleasant border. There we've had 28,775 vaccinations given, and that's over the course of a period of time that dates back to mid-January. Smaller numbers at the local clinic and at the county community college, and that has not been open that's not been open 7 days a week at either one of those locations. In all of these cases, we wait for allocation of doses that are given to us by the state of New York. We're going to touch on that in a short bit, but we're still not at the point where we have sufficient doses to meet the demand. The general numbers that we've been working with is about 15% of the people, slightly over 15% of the people are fully vaccinated. Another 15% of the people have had their first shot. So over the course of a couple of weeks' time, we should be up to 30%, over 30% vaccinated. And that number rises every day because of the number of vaccinations we have. However, we're dealing as well with other factors in the society, and keeping in mind that the vaccinations make it less likely that you'll get the disease, but does not eliminate the chances of you getting the disease. It also means you are less likely to be hospitalized and less likely to suffer fatality from the disease. But it is not an automatic situation that ensures that you won't possibly get the disease. And that's true of any vaccine. For those who take flu shots every year, it is still possible for you to get the flu. You get a less violent version of it if you do contract the flu, having had a flu shot. And the same is true as well with COVID. So with that, we're going to stop our narrative and continue in a few seconds to give you some of the updated information that the state's put out, which is very encouraging. But I'd like to introduce Greg Luisi to join us here at the podium. Greg has served 10 years on the Village Board of Tuckahoe, longtime Tuckahoe activist. He's played Santa Claus at the Senior Citizen Center, as well as presiding over the village board meetings for the last 2 years. Very likable figure. We're in different political parties, but that hasn't stopped us from having a friendship and a great respect for the work that he's done. So, Greg, tell us a little bit about the wonderful village of Tuckahoe that you love so well. Thank you.
Thank you, George. Ken. You know, from the very beginning of the pandemic, George and your staff have created this atmosphere which enabled the village of Tuckahoe to get through this pandemic. The assistance that you provided, the information that you provided us was invaluable to me as well as the members of my staff. What Tuckahoe did from the very beginning of this pandemic was our police department staggered the shifts. What they did was our police chief put the officers on 12-hour shifts in order to minimize the contact between the officers when the shifts were changing. Likewise, our Department of Public Works also did the same thing. They staggered the shifts so there was minimal contact between employees, therefore minimizing the possibility of contracting COVID. What we did with our businesses in order to encourage our restaurants to continue to survive is we extended the outdoor seating up until October of this past year. And as a matter of fact, just recently we've extended it going into this year, enabling them to sort of decorate the outside to make it look a little bit more conducive to eating outside. But probably more importantly is Trustee Elmira Andino has been able to get not only COVID testing, but even as of just today, I helped out in vaccinating 25 of our Tuckahoe seniors. In total, 200 Tuckahoe seniors have received the vaccine to date. Our police department throughout this pandemic this past year, in cooperation with the Eastchester Chamber of Commerce and Jennifer Vetramile, who is our Director of Seniors in Tuckahoe, we're delivering dinners to our seniors who were homebound and obviously didn't have that ability to get out and eat and or shop. So this has occurred several times throughout the past year. And again, I'm very proud of our police department and our chamber for this collaborative effort. In closing, I'm very, very proud of all our employees here in the village. We still maintained our office hours. Again, we staggered office hours, so no two employees were ever in the building at the same time. Throughout the course of the year, we put up protective plexiglass throughout all those common areas, so there is no direct contact between the village employee at Village Hall or the public. And we continue to do this, and we continue to have hand sanitizer readily available for anyone who comes up here. And in closing, fortunately for us, for the village of Tuckahoe, entering into the pandemic, because of our reserve fund, the economic impact was not as severe as maybe other municipalities had to deal with. That's not to say that coming into this budget cycle that it's going to be any easier. It's going to be tough, but thanks to the stimulus money, that we will be receiving from Washington. It's going to help us get over the hurdle. It won't be easy. It's going to be tough, but it's better than nothing. So in closing, again, I'd like to thank you, County Executive George Latimer, young man, Mr. Jennings. These are my last few days of office, and I am honored and privileged to have been here to share this with you. So thank you again. Stay safe and be well, everyone.
Thank you, Greg. Thank you very much, Greg Luisi. I'm still honored to call him mayor for the next week, and I'm honored to call him my friend for as long as we're both here with us. So thank you very much. We try as many times in these updates as to bring in different municipal officials from around the county, town supervisors, village mayors, and city mayors as well, so that they can tell a little bit about their community, what they've gone through. This is something that we said very much at the outset, that none of us had a roadmap to follow. And as the state has made decisions and set policies, those of us in village, town, city, and county government work together, try to figure out how do we administer this, how to keep as many people safe as we can, and how do we keep as much open safely as we can, because people still do want to live their lives and have some of that pleasure with it. So again, Greg, thank you for being with us here. And for those who may be watching from Tuckahoe, it's been an honor to represent you in the state Senate, and now with this responsibility to work with you as well. So going to some of the other information that we have here, a lot of news that came out of the state today that's very important, and it's good news if you're under the age of 50. Most people aren't dying to be 50 years old unless you're well over 50, as I am. But tomorrow, if you are 30 years of age and older, you are able to schedule appointments and get your vaccine shots. So if age 30 and older, available for vaccine shots tomorrow. That's the 30th day of March. And that's going to continue on as we try to get to a much larger cohort of people in the pandemic, New York state law. And then starting April 6th, which is just about a week later, New Yorkers 16 years of age and older can begin to schedule appointments and get vaccinated. So that now basically allows us to vaccinate everybody in our society. We have been worried about people with underlying health issues. We've been worrying about people who work in certain types of jobs and so forth. All of that now is moot. If you are 30 and over, any capacity situation, you get a vaccination. Shortly thereafter, 16 and over, makes our life a lot easier in trying to figure out how we're going to handle these things. But we are still going to continue to work in a host of different areas. With this universal eligibility, the state will be ahead of the deadline set by President Biden, which was May 1st. And I think it gives us the opportunity, however, to continue to do very specialized vaccination opportunities in those communities where we're still trying to reach senior citizens, people who may not have computers, may not be computer savvy, find it difficult to navigate the process by which they can get a vaccination. Those people who are poor, people of color, folks who may not have English as their prominent language, all of those different constituency groups will still see special pop-ups or temporary vaccination locations. We continue to operate the county center on an ongoing basis. That's about 2,500 vaccinations a day at our local clinics. The Yonkers Armory is still open at this point. We'll see what the game plan is for that in the long term. That's sort of up to the federal government and the state government to determine that. But we're going to try to make as best as we can as a county government, working with the higher levels of government, vaccinations easily available. And then, we go into a period of time where we reach that point at which everybody who wants a vaccination has it. We don't know if that gets us to 60% of the population or 70% of the population, but we know that there's a cohort of people that would prefer not to have a vaccination, and we'll see what we deal with that issue as we get closer to it. I would suspect we're at least 60 to 90 days away from reaching that point. So we're thinking about it, but we're not necessarily worried about it right now. If you want a vaccination, you're going to be eligible for the vaccination. We're going to try to get you that vaccination. And particularly if it's a 2-shot vaccination, the logistics required to have you come back in 3 weeks or 4 weeks, depending on the kind of product you get. Get us all vaccinated, make us as healthy as we can, try to open up as much of the society as we can do responsibly. And as we do that, then we'll start to feel some sense of normalcy. I do believe, we've talked about this, I think we're going to see a much better late spring this year than we saw last year, a much better summer. I know there's always a big fireworks show at the Oval in Tuckahoe. The place is jammed. I don't quite know how that's going to work, but we'll see. We are going to open Playland. No fireworks at Playland this year, but we'll have Playland back open, and we'll try to do things that'll be helpful. If you go onto the New York State website to make an appointment, the Am I Eligible screening tool, which is one of the things you can click on to, we'll update information for you. But as we get closer to universal eligibility, the MI eligible factor is not quite as important. So let me ask Ken Jenkins now to give us an update on some of the allocations that we have, some of the positives and some of the other factors involved.
Thank you, George. This week's allocation, we're in week 16. We're definitely in week 16 of the vaccination that are being distributed. That will be on the county's webpage. This week is already up and running for week 16. What you will notice that there are many new pharmacies that have been added, and they are receiving the Johnson & Johnson Jensen vaccine. That's a great sign. I know that we were all in County Executive Latimer pointed out that we were all expecting after that first initial tranche of J&J vaccinations that we got, the one-shot vaccinations, that at the end of the month, we were going to start to see some more, and great news that the local pharmacies are getting that J&J vaccine. And again, at the MI eligible website is where you can sign up, and you still will need, even with the reduced eligibilities, you will still need an appointment to get those vaccinations. This week on homebound, we're not, from the county, are not doing homebound vaccinations this week. The county executive director and Joe McDonald and the team have made sure that we had a robust homebound program. And that program, again, takes a little bit longer because I'm going to individual homes, but for those people that cannot get out and that need the vaccine, that it was extremely important to do that. It was certainly something that worked with all the local governments, including the village of Tuckahoe, to identify those homebound individuals to make sure that that happened. So we're continuing to ask that those homebound eligible individuals who would like to be vaccinated communicate their municipal office. Contact Mayor Luisi's office if you live in Tuckahoe, the village town manager, or your town supervisors in many of those cases, to make sure that we are having an up-to-date list so that when these things happen, and we have mentioned this, County Executive Latimer has mentioned this many times, that we get these vaccines that come in and it's maybe a day or two before those need to be turned around and placed in people's arms, or we will not receive those vaccines again. So we want to make sure that we have our local homebound individuals ready to go, and we've been communicating with the municipality, and we thank all of their work for doing that. So we will be vaccinating those homebound individuals as supply becomes available. Again, we are expecting that we're going to get another tranche, a large tranche from Johnson & Johnson. They were supposed to have 20 million that were ready for the entire country, and we will get our appropriate allocations for that. Thanks a lot.
Thank you, Ken. Now, we've got some good news for folks who are familiar with the Glen Island facility in New Rochelle. Certainly, if you live in the south end of New Rochelle or adjacent Pelham or any place that allows you to go to Glen Island, starting tomorrow, Tuesday, Glen Island will be open to pedestrian and vehicular traffic for the first time in over a year. You may recall that a year ago, we turned over the Glen Island complex to New York State so they could set up the first mobile testing location, and it was the beginning of our robust testing program. We've now done 2.3 million tests for COVID in Westchester County, and testing is in numerous places now, whether it's the Binex card or the normal swab testing that we've gone through. But Glen Island, which is a great facility, it has the largest beach that we have in our Westchester County park system. It has a great open area, well known for picnics and so forth, has been closed to outside traffic, pedestrian traffic as well as vehicular traffic. That ends tomorrow. The lobbying has been intense by the residents of New Rochelle, by Mayor Bramson, members of the City Council, Al Tarantino and Martha Lopez both. We also have County Legislator Terry Clemens and Damon Marr have all been lobbying for this to happen, as have we, and the state has now reconfigured the traffic flow and the security flow, which will allow for people to go into Glen Island to enjoy the beauty just in time for the spring. so that you can go out and enjoy some of that. Public parking is limited, so it's always better to walk in if you can. A lot of folks go down there for their exercise. There will be approximately 300 spaces available daily at Glen Island for public parking. It'll use part of the existing lots and some of the grass areas so that you can park and walk around. We're not charging for parking at this stage of the game. Obviously, a little bit later in the year, we'll see what kind of demand we have and what happens to the testing center. But the COVID testing center continues. It's not being shut down, so we do have to work around that reality as that COVID testing is still essential. Public use of the park are for residents only, Westchester County residents, and you will be checked prior to coming in. Obviously, if you're watching this and you live anywhere in Westchester County, this is a facility paid for by your taxes, so now that we open the door to it, you're eligible to come, but those from outside the county would not be eligible. We have limited space. We want to make sure Westchester residents get to enjoy that. The park, for the moment, opens at 8 a.m., closes at 7 p.m. That's pretty much, a period of time where you could have light in the sky. There are no picnic reservations at this point. There are picnic areas are sort of on a first-come, first-served basis. I guess if you get there with your picnic basket, that's what that means. There are no buses that are going to go into the complex, and no boat launching is allowed within the complex. The county police will work with the Parks Department, the state police, all working together. There are no obstructions to go to the Glen Island Harbor Club if they have an event there, and their schedule is going to be shared with the police so that they're aware of it, with the Parks Department, and so that if you are going there for a catered function, as you know now, there are legal and appropriate there with limited attendance, you will be able to enter. There's sort of a left-hand turn, and then you go up over down to the Harbor Island Club, and there should be no impediment for you to do that. The Pelham Rowing Club has been advised to the reopening. They're agreed upon the area that they are allowed to be in, so their continued involvement there is as well. So we think that's very good news for folks in New Rochelle. Folks have been asking me about this for 6 months. We've made the inquiries to the state a number of times. Finally, we're at a point now where the negotiations work, and Glen Island opens up to our fellow residents to be able to go down, walk, and enjoy. We're going to close with a note that is not COVID-related, but very much in the popular domain, and that is combating hatred against any ethnic group, and particularly against Asian Americans. We've seen a rise in actions against Asian Americans for any number of different reasons. The Westchester County Human Rights Commission will be sponsoring a virtual panel discussion on the combating hatred against the Asian American community, and that's coming up on Thursday of this week. Let me just double check. Thursday is April. We actually mean Tuesday, March 30th. It's Tuesday. Do forgive me. It's Tuesday, March 30th, tomorrow night at 6 p.m. The program will discuss the surge in hate incidents and racism against Asian Americans, and we have an all-star panel. It will include Reverend Doris Dalton, who's the chair of our County Human Rights Commission. She is Asian American. Mayo Bartlett, Esquire, lawyer, co-chaired our Police Reform Task Force. We have Bill Kong from the Asian American Advisory Board and the Organization of Chinese Americans. We have Dr. Youngyi Deanna Pan, who's Associate Professor of Sociology at Brooklyn College, and she'll bring her academic credentials into the conversation. And we have Kairu Tong, who is a graduating senior from Ardsley High School. Recently was part of the organizing group that had a rally at Pascone Park in Ardsley. And all of them will be on the panel. They'll have some discussions. There'll be questions. If you want to register for the panel, 995-7710, or you can email humanrights@westchestergov.com, 995-7710, humanrights@westchestergov.com. They will give you the webinar information that you can click on from the comfort of your own home. You can listen to the discussion, and there will be a question and answer component, perhaps in the chat room. I'm not sure quite how they'll work it out. But so to make sure we have the date right, it is tomorrow, Tuesday, March 30th at 6 p.m. I assume it'll last an hour, maybe slightly more than an hour, but if that's something that's of interest to you, please tune in, and we think that will be very helpful. We will be back again for our next update on Thursday of this week. We want to wish all of our Jewish brothers and sisters that are in the middle of their Passover celebration. We've had both the first and second night of Passover and the Seders involved. And to all our Christian brothers and sisters that are going through Holy Week. Palm Sunday was yesterday, and we have ahead of us Holy Thursday or Maundy Thursday, depending on your the portion of Christianity that you're active in. Good Friday follows the most solemn day on the Christian calendar, and then Easter Sunday, the most joyous day on the Christian calendar. So this is a time where two of our major religions come together, and we want to wish both our Jewish brothers and sisters and our Christian brothers and sisters appropriate respect for these days, which means so much to their faith tradition. In about a month, you'll see us do the same to our Muslim brothers and sisters as they enter the season of Ramadan. We are a big mosaic in this county. We respect each other's traditions, even as we cling to our own traditions, but we're a stronger society because we work together. That's what got us this far. That's what's going to get us to the future as Americans, is that we're Americans who cherish our heritage and we cherish our common future together. Catherine Chaffee, do we have any questions from the press?
We do. We have a few questions from David Proper from the Journal News. The first one is, do you have the latest hospitalization numbers?
Okay. David Proper from the Journal News, lowhud.com. David, the current number that we have for hospitalizations is, as of Saturday, March 27th, 259 individuals are hospitalized in Westchester hospitals. And just to give you a perspective, it's come down a little bit over the last few days. Friday's number was 267. Thursday's number was 274. Wednesday's number was 287. So the last 4 days we've dropped to get to the 257 number. But a week ago, on Saturday the 20th, we were 256. So we were at a certain number, we rose, and we dropped back down over the course of the last week.
Second question is, you say variants are possibly affecting the number of cases. So what information has the state provided to the county about variants, and how many of each variant is in the county?
Those are numbers, David, that we don't have access to. As I've said many times before, the state has all reporting go to them. So every positive COVID test, every individual that is hospitalized, or for those that are fatality, all that information is reported to the state. The state puts out on their tracker that information we have. We don't have accurate information that tells us how many people have what level of issues to deal with. So we don't know, for example, if a person's test positive, if in that test they've then determined that they have one of the number of variants. So that's why we can't make a firm prediction as to why things are happening the way they are. We try to make the best possible prediction. We know that from general dialogue that the variants are present. We know that the UK variant has been found in Westchester in some cases. We have not heard of a case of either the Brazilian or the South African variant in Westchester County. That doesn't mean it's not here. You know, most people speculate now that COVID was in Westchester long before the first case was discovered last year. But we're working off of what data we have from the state, and we don't have a breakdown of variants.
Okay. And his third question, which is his final question as of right now, is, do you think the state is opening too quickly, considering the cases are now inching up?
Well, I think we're all concerned about the inching up process, and I think that for the reasons that I said before, it's not as much that the state is opening up as that we as individuals are opening up. We feel the warm weather. We feel the desire to, get back to the, sort of the life that we had before. I do see more people taking off their masks in more contexts. It's subjective, but, I travel around the county pretty thoroughly. I'm in almost every corner of the county most days, and I do think that it's how our behavior is triggering that action. When you look at it, say, from the county standpoint, where are we today versus where we were a year ago? We opened up our golf courses a year ago. We've opened up our golf courses a year later. We are opened all of our parks for walking, hiking purposes. We have not yet gotten to the point of Bicycle Sunday. We certainly haven't gotten to the point of pools and beaches and playland. So functionally, what is open in Westchester County that we have control over are the same things that were open a year ago. And of course, the level of infection from now to where we were exactly 12 months ago is down, fairly dramatically. The opening up process as we go forward really isn't dramatic. I mean, you're still seeing percentages of below 100% of occupancy in restaurants. I think the last number I saw was 75%. We've seen an increase in the percentages of attendance at houses of worship, but I can speak just from having been to any number of different churches that there's still social distancing going on, which practically reduces the number of people in a church because you're cordoning off certain rows of seating, so you wouldn't have maximum attendance regardless of what the percentages are. Our schools are socially distanced, and we've gone through this whole process of remote learning and hybrid learning and so forth, so we're not 100% back into school. So I don't think we're at the point where Texas may be. And of course, we're nothing like what we saw with in Florida for the spring break, where out on the beach was enjoyment as usual, as you would expect to get in the summertime, in the springtime. Breakaway goods. So I don't think we've opened up as much as other places have. So I don't think that's a reason for the increase. But none of us know for sure. We're trying to make educated guesses. And even if we knew precisely, the question is, what do we do about it? What do we do about it is we make vaccinations as available as possible. We provide PPE to as many people as possible to protect themselves and sanitize themselves. I was at a pop-up this weekend at Hope Community Services in New Rochelle, where we had 200 some odd people vaccinated there. There were other similar facilities going on in the ongoing locations, and people are trying to practice all the right behaviors and activities. So, I think we're doing what we can do, things that are within our control: testing, vaccination, social distancing, providing materials for folks, and really trying to get the message out that we're not out of it yet. So we need to still show discipline and a little bit of, it's hard to say, there's a little bit of self-denial at this stage of the game. We have one more question.
One more question from David Proper.
Okay.
Shouldn't the state better convey the situation with the variants in Westchester if it has the potential to slow progress?
Well, we're going to ask the state to see how they can give us additional data. I think your question, David, is again David Proper from Journal News, is a legitimate question, and people, clearly want to know more facts about what's happening. So, all of us are not satisfied with getting just some of the information, because curiosity leads you to ask follow-up questions. Knowing more about the variants would be helpful to know, and it would help us put into perspective what the uptick is. I don't know how easy it is to determine that from a test. Maybe it's easy, maybe it's not. I need to have a greater science. I should pay more attention in school to science. But we don't know how easy it is to find out that information or not. But we will urge that we have more of this information so we could share it with the public. We share information fairly transparently because we want people to have a sense of confidence, but not built on false assumptions. A confidence that comes from a practical mindedness that I think we all share. How many of us have had COVID? How many of us have been through a COVID scare where we thought we might have been exposed to COVID? How many of us have lost a friend? I often talk about the first prominent person that I know who's a good friend of Greg Luisi's, Glen. We have personal experiences with this. So there's no reason to be sunny optimistic inappropriately, nor doom and gloom pessimistic unnecessarily. We want to build it on facts. But what facts we have at this stage of the game, or what is available to us from the state, we will advocate for more. And on our dashboard, whatever information we get, we will share it. And we'll share it publicly, and you're able to access it on an ongoing basis. All those questions from David Proper from the Journal News. We thank anyone from the press that has been following this. They will obviously excerpt this. We have not yet invited the press to come in to cover these things in person for their protection, so that there's no interaction that could possibly infect them. As soon as we get a sense that we can do that safely, we're happy to do that, but we open up this line of communications. Any individual in the press that wants to reach out to us, speak to Catherine Chaffee, 995-2932, and she'll be happy to set up ongoing conversations so that we can give you the information as we have it. Every Monday after this is over, we have a 3:30 call with the municipal leaders, all of the mayors and supervisors of the various communities, the town and village and city administrators, where we're going to share some information on COVID and on some other related topics. And although this is school break week this week, next Monday we'll resume our Monday morning calls with various school superintendents, and we'll talk about issues that relate to schools. So we're trying to be as interactive as we can, as transparent as we can, give you the information we have as soon as we have it. So thanks for watching. I'm George Latimer, Westchester County Executive. We wish you a safe week. We'll be back on Thursday, and if we have any other information that's of an urgent nature, we'll let you know. The big headline story, starting tomorrow, 30 years of age and older, you're eligible for a shot, and take it. It's good for you. It's good for the society around you. Have a nice day. Stay safe.